So hey yo guys, in this video we are going to discuss about healthcare administration or management as a profession in Australia. Let's start this video by talking about their roles and duties. They develop, implement, and monitors the procedures, policies and standards for medical, nursing, allied health and administrative staff. They also control administrative operations such as budget planning, report preparation, expenditure on supplies, equipment and services, etc. One of the first thing we search about a profession is their pay scale, so that we can get an idea whether we can buy a mansion with a swimming pool in the backyard, or we gotta live in the basement of the creepy old man. So as a healthcare administrator in Australia, you can earn from $59,000 up to $90,000 per year. This is the base salary, and it does not include bonuses or any other thing because it will just only complicate the numbers. Since we have talked about their salary now, it will be appropriate to talk about their average weekly wages now. So as a healthcare administrator in Australia, you can earn up to $2,148 per week. Now let's talk about the data showing the educational qualification of the people employed as a healthcare administrator in Australia. This data will be helpful for you to understand how much you should study, and how does just based on the education qualification, your chances of employment will be affected. 30.7% of the healthcare administrators who are employed in Australia have done postgraduate studies. 29.2% of them have bachelor's degree. 14.2% of them have advanced diploma, and rest about 25.9% of them have lower qualification than advanced diploma. From this data, we can interpret that advanced diploma can be considered as a good starting point, but having a bachelor's degree educational qualification will open many more employment chances for you. Now let's move on and talk about the percentage of healthcare administrators employed in different industries in Australia. 82.3% of the healthcare administrators are employed in healthcare and social assistance, 5.8% in public administration and safety sector, 2.1% in professional, scientific and technical services sector, 1.9% in education and training industry, and 7.9% in other industries. Since we have talked about the industries in which healthcare administrators are employed, now let's also see the data showing the percent of healthcare administrators employed in different states. This data will be useful for you to understand which state in Australia could offer you better opportunities in comparison to others. In VIC, NSW and QLD, majority of the healthcare administrators are employed, which have 27.4%, 30.7% and 18.8% of healthcare administrators employed respectively. The employment opportunities in SA and WA are 7 and 10.8% respectively for healthcare administrators. Other states like TAS, NT and ACT have almost similar percentage of healthcare administrators employed in Australia. Now let's talk about the gender distribution in this profession. About 76% of them are female, while rest 24% are male. The percentage of healthcare administrators working full-time in this profession are 73%, while others are working on part-time basis. On an average, a healthcare administrator who is employed full-time works about 44 hours every week. Now let's talk about whether to work as a healthcare administrator you need some kind of registration or not. So the answer is yes and no. By this what I mean is that someone who just want to do management role, then registration may not be required, but for someone looking for versatile role, then registration may be needed. To be employed as a healthcare administrator, following skills and knowledge is usually required by the employer. Knowledge such as English language, clerical, administration or management, and education and training. Skills such as critical thinking, coordination with others, active learning and active listening are usually required. Some of the college or universities offering such programs are Australian Catholic University, Curtin University, University of Adelaide and La Trobe University. If you want to become a healthcare administrator in Australia, you should be ready to pay about $20,000 to $30,000 on an average every year. If you have watched this video till here and have any doubts, please comment down below and I would love to make a video on it, or reply you. If you liked the video, do not forget to like and subscribe to this channel. Thank you for watching this video and I will see you next time with more useful video. Bye bye.